Hello, everyone. My name is Darlene Zangara, and I'm the Executive Director of the Minnesota Commission of the Deaf, Deafblind, and Hard of Hearing. I will start with a visual description of myself. I'm a white woman with blonde hair, glasses, and wearing a black shirt. We have now entered a new year, 2026. We expect to be busy this year with the upcoming legislative session and community engagement. It is also an election year. Voters will elect a governor, attorney general, secretary of state, state auditor, one U.S. senator, 8 U.S. representatives, and the entire state legislature. Current situation in Minnesota. We have been hearing from community members with questions about ICE, fraud, and how the federal and local governments are working together. We know many people are feeling worried, confused, or unsafe. There is a lot of information online and in the news, and some of it can be hard to understand or may conflict with each other. We want you to know that we hear you and we take your concerns seriously. Here is what we can share. First, we stand up for our communities. The Commission will continue working to reduce barriers and support our communities, no matter what is happening politically. The legislative session starts on February 17th. We will work with legislatures from both parties to move forward the Commission's policy priorities. We will also work to protect programs and services that already exist in Minnesota. Second, we support voting and your right to choose. We believe voting is important. Voting helps people have a say in decisions that affect their lives and their communities. We are here to help you understand your voting rights and learn how to find information about candidates and issues. As a government agency, the Commission cannot and will not tell you who to vote for or promote any political party. Third, our events will be safe and accessible. We will work to make sure all events hosted by the Commission are safe, welcoming, and accessible to everyone. This includes changes to our original plans for Lobby Day. More information about Lobby Day changes is in a separate announcement. Fourth, we will work to make public information accessible. We work with the Governor's Office and the Minnesota Department of Public Safety to make sure press conferences are accessible. This work will continue. Fifth, we share helpful resources. On January 16th, we sent a newsletter called Public Safety, Personal Safety, and Your Rights. It includes helpful information about communication, access, and knowing your rights. voter information, and privacy. We have also received questions about a request from the federal government to access Minnesota's voter rolls, which includes personal information about voters. The Minnesota Secretary of State's office has clearly said no to this request. If you are worried about your private information being shared, please know that the Secretary of State's office has committed to keeping your information private and protected. The Secretary of State, Steve Simon's full statement is available on the Secretary of State's website. "2026 Public Policy Agenda." The board met on January 16, 2026, and approved our 2026 Public Policy Agenda. You can find the agenda on the Commission's website. Some of the agenda items are: continue to review age-related hearing loss policy gaps and make recommendations, update human rights law to clarify closed captioning needs to be always on when TV services is provided to the public, gather information and address deaf, deafblind, and hard of hearing needs for the new kindergarten assessment requirements scheduled to take effect in 2027, and more. Legislators will return to the Capitol on February 17th. We are ready to work with them to make sure programs and services that help Minnesota's deaf, deafblind, and hard of hearing community are protected. Last August, Commission staff attended the Minnesota Hands and Voices annual gathering. Hands and Voices is a support group for parents of children who are deaf, deafblind, or hard of hearing. The staff enjoyed meeting parents and connecting with other organizations and schools that support these families. In September, Darlene and Ann attended the Cytomegalovirus CMV conference in Minneapolis. CMV is the most common cause of birth disabilities, including hearing loss in infants. Minnesota is the first state in the country to require CMV screenings for all newborns, and we are proud to support this important public health effort. In December, Darlene and Keith joined the Minnesota State Academy for the Deaf winter program, where we met with students, families, and school staff. We shared information about the commission and helped families understand resources like IEPs. We also enjoyed watching the students' holiday performance. Great job, everyone! In January, Darlene and Ann went to Minnesota Hands and Voices skating event for families, where we helped with the photo booth. and interacted with families and staff. It is always a pleasure to work with Minnesota Hands and Voices. The new 2025 Collaborative Plan Report is now available. The Commission's work depends on strong collaboration with community partners to improve education and career outcomes for deaf, deafblind, and hard of hearing students. Community members, partners, and caregivers shared that Minnesota has a strong system of services for these children. They also highlighted areas where programs could be better supportive towards families, especially after the COVID-19 pandemic. During a recent summit, participants created a 5-year plan to support children and youth from birth through age 22. The plan identifies 6 focus areas and specific action steps for the Commission's work between 2025 and 2030. It also aims to better coordinate efforts across different working groups. To learn more about the 2025 Collaborative Plan, please visit our website. If you have questions, email Danelle. The board had a retreat in St. Cloud last November. The main goal for the retreat was to identify essential issues for the Commission to focus on for the next 2 years. There were presentations given by Ashley Ullman on the challenges and commitments our state leaders face in this time of leadership and how we can change the tide to work in our favor. Stacy Sondren on board members' roles and authority for governor-appointed board members. Nancy Block on communicating governance principles with our communities. And Dr. Mohammed Morsi Alfas on the statewide community survey results. Dr. Morsi Alfas analyzed the survey results, which identified 4 important steps to strengthen community engagement and accessibility statewide. First, increase awareness efforts in Greater Minnesota through local collaboration and accessible digital materials. Second, expand interpreter training programs, mentorship opportunities, and outreach to high school ASL educators. Third, continue advocating for affordable hearing aids and equitable healthcare coverage. Fourth, improve transportation policy coordination and SSP access, monitor awareness, satisfaction, and accessibility metrics on a quarterly basis. I am so thankful to work with such a strong and committed board who are community-driven and results-oriented. I'm also thankful to every single person in the community who participated in the statewide survey. Your feedback makes a difference. Here are pictures of recent events, including our 40th anniversary event in St. Cloud and the Dr. Martin Luther King Jr. celebration at the Ordway. In closing, my door is always open. Please contact me anytime you would like to discuss deaf-blind, and hard of hearing issues in Minnesota. We are here for you. Thank you.